Let's have a quick overview of the suprarenal adrenal glands. Remember that they are paired pyramidal organs on the superior surface of the kidneys and are highly vascularized. There are three groups of 60 small suprarenal arteries which supply each gland. The superior suprarenal arteries from the inferior phrenic artery, the middle suprarenal arteries from the aorta, and the inferior suprarenal arteries from the renal artery. Then the veins, left suprarenal vein drains into the renal vein, and the right suprarenal vein drains into the inferior vena cava. So taking a look in more detail, remember that these glands are separated into two regions, the suprarenal cortex and the medulla. Looking at the cortex, we have the zona glomerulosa, which produce mineral corticoids, then the zona fasciculata, which produce glucocorticoids, and zona reticularis, which produce androgens. Example of the mineral corticoids from the glomerulosa would be aldosterone. Example of the glucocorticoids from the fasciculata would be cortisol. An example of the androgens from the reticularis would be testosterone. Now, if we think about the suprarenal medulla, we should know that there are chromaffin cells which produce epinephrine and norepinephrine. Modified ganglionic sympathetic neurons. Chromaffin cells secrete catecholamines, which the amine hormones epinephrine and norepinephrine, and they are active in the fight, flight, and fright response. And these hormones are stored in secretory vesicles. So to sum it up again, let's talk again about the cortex, the zona glomerulosa, fasciculata, and reticularis again. So the glomerulosa, zona glomerulosa, the hormones are mineral corticoids, which are primarily aldosterone, which target the kidneys. And the effects here would be an increase in renal absorption of sodium ions and water, especially in the presence of ADH, and this accelerates the urinary loss of potassium ions. Then the zona fasciculata, the hormones here are glucocorticoids, cortisol, for example hydrocortisone, and corticosterone, cortisol converted to cortisone and released by the liver. So the targets here would be most cells, and the effects here would be the release of amino acids from skeletal muscles, lipids from adipose tissues, promoting formation of liver glycogen and glucose, and promoting the peripheral utilization of lipids. So we also have anti-inflammatory effects. Then the zona reticularis, the hormones here would be the androgens, and the effects would be, well, uncertain significance under normal conditions. Then we have the medulla, and the hormones here would be epinephrine and norepinephrine, targeting most cells, and the effects here would be increased cardiac activity, blood pressure, glycogen breakdown, blood glucose, and the release of lipids by adipose tissue.